Hello, everyone. Today we'll be talking about ECG interpretation in myocardial infarction. थोड़ा सा heavy हो सकता है, but I'll try to make it as simple as possible for you people. So first of all, let's learn about myocardial infarction. In the previous videos also, we had talked about MI, which is also known as heart attack. इसमें क्या होता है? There will be irreversible death of the heart muscles secondary to the sustained lack of blood and oxygen supply. Because of atherosclerosis or because of other reasons, there can be a decrease or there can be no supply to the myocardium, a portion of the myocardium causing the myocardial infarction. And through ECG, you can identify various various kinds of your myocardial infarction, which will be helping you in planning the other diagnostic tests and also to plan for the management of a patient. So it is very important to know about which all type of changes, ECG changes a patient can have with the myocardial infarction. So let's learn about that. So when we talk about myocardial infarction, we can have broadly two types of myocardial infarction, that is STEMI and NSTEMI. And STEMI is also known as non-ST segment elevation myocardial infarction, and STEMI is also known as ST segment elevation myocardial infarction. So just to differentiate what is important, STEMI is more severe form as compared to the NSTEMI. And apart from the ECG changes, the patient also has been the test for the cardiac biomarkers is also done, which is your TROP-T and TROP-I, which also seems to be positive in both of the types of your myocardial infarction. So let's talk about the ECG changes which happen in the myocardial infarction. तो कौन-कौन से changes हो सकते हैं? The patient might be having the ST segment elevation. कहाँ पे होगा वो? उन leads में which represent the damaged part of the heart. Then the person might be also having the ST depression. वो कहाँ पे होगा? In those leads which are opposite to the damaged part of the heart. And then they can also be the presence of inverted T waves, and they can also be pathological Q wave presence. So when we talk about the ST elevation, ST segment elevation in MI, it depends on the duration of myocardial infarction. Normally, अगर आप यहाँ देखोगे, you can find out that the ST segment is like this. You know, this is also known as isoelectric line. तो आपके पास जो ST segment है, वो isoelectric line के पास ही है. It is on the isoelectric line only. But when a patient has the acute myocardial infarction, there can be ST elevation. यहाँ पे आप देखो, you just try to compare this with this. है ना? यहाँ पे it is like on the isoelectric line. But when we compare it with this picture, it is elevated. तो यहाँ आप देखोगे isoelectric line से ये elevated है. It means a person is having the acute kind of myocardial infarction, or there is ST elevation present. When after few hours of having the myocardial infarction, what starts to have? ST elevation is continued here. You can observe here, but you can see here the amplitude of R is decreasing. Or you can say that ST elevation is more prominent as compared to the amplitude of your R wave. And one more thing you'll be observing here is the Q wave starts appearing. है ना? यहाँ पे Q wave जो है आपको deep दिखेगी. Normally Q wave is not that deep, but if you are able to observe it, it means there are a few hours after the myocardial infarction. Then in day 1 to 2, what is happening? The T wave also starts to have the inversion, and the Q wave become more deeper. Few days afterwards, after your myocardial infarction, there can be normalization or stabilization of the ST segment, plus the T wave might be inverted. And after a few weeks of myocardial infarction, ST and T comes to be normal, but the Q wave persists. It remains deep only. So these are few changes happens in the morphology of different parts of ECG, like your ST segment, Q wave, R wave, and the T wave, depending on the duration of myocardial infarction. So first of all, you should know about different kinds of leads and which all portion of the heart they represent to. We know that we talk about the 12 leads where you have the chest leads and the limb leads. We have lead 1, 2, 3, lead AVR, AVL, AVF. AVR stands for augmented vector right, augmented vector left, augmented vector foot. Then we have the precordial leads, which are also known as your chest leads from V1 to V6. That is V1, V2, V3, V4, V5, V6. Each one of these leads tell about different portions of the heart. Okay. तो बहुत जरूरी है कि आपको याद रहे, है ना, ये आपको दिस पिक्चर शुड बी ऑलवेज इन योर माइंड एंड यू हैव टू मेमोराइज इट, बिकॉज देन ओनली यू विल बी एबल टू फाइंड आउट डिफरेंट टाइप्स ऑफ योर मायोकार्डियल इंफार्क्शन. तो हम स्टार्ट करेंगे V1 से, ठीक है. तो V1 and V2 tells about the septal portion of the heart, right? V3 and V4, V3 and V4 tells about the anterior part of the heart. V5 and V6 tell about the lateral part of the heart. Okay, याद रहेगा. V1, V2 septal part, V3, V4 anterior part, and V5, V6 lateral part of the heart. Then comes towards your lead 1. Lead 1, lead AVL tells and lead V5, V6 tell about the lateral portion of the heart, right? तो आपके पास septal के लिए 2 leads हो गई, 1, 2, V1, V2. anterior के लिए 2 लीड्स हो गई V3, V4, और लेटरल के लिए 4 लीड्स हो गई V5, V6, लीड 1 एंड लीड AVL. जस्ट फॉर अ क्विक हिंट, यू कैन रिमेंबर AVL में L आता है, लेटरल में L आता है. तो AVL denotes the lateral portion of the heart, right? Then your lead 2, 3 and AVF tells about the inferior portion of the heart. तो आपके पास inferior portion को बताने के लिए 3 लीड्स हैं, lateral portion को बताने के लिए 4 लीड्स हैं, एंटीरियर पोर्शन को बताने के लिए 2 लीड्स हैं, और सेप्टल पोर्शन को बताने के लिए भी 2 लीड्स हैं, राइट? यू विल टेल मी इन द कमेंट्स which portion of the heart does the AVR signifies. I have not told you, but you have to. This is your assignment. You have to find out, does AVR also denote some of the portion or something else, right? So we'll talk about the location of infarction. Why it is important to remember or memorize these different areas which are signified by these leads, because if you want to classify the myocardial infarction into anterior MI, posterior MI, inferior MI, lateral MI, you should also know which portion is supplied by that, and because of which we'll be observing the changes in those leads only. So when we talk about the anterior myocardial infarction, ST elevation can be seen in the anterior leads. Which all were the anterior leads? V3 and V4. When we talk about the septal leads, septal MI, the septal leads were V1 and V2. Usually, the people might be having the septal MI along with the anterior MI only, which is known as anterior-septal MI. And then the ST elevation can be seen from V1 to V4. Okay, V1, V2, V3, V4 tells you about anterior-septal myocardial infarction. When we talk about the lateral MI, you can see here, lateral MI, कौन सी लीड्स अफेक्ट होंगी? लेटरल लीड्स अफेक्ट होंगी. लेटरल लीड्स कौन सी है? 4 लीड्स लेटरल है, V5, V6, लीड AVL and lead 1. Right? So, आपके पास lead 1, lead AVL, V5, V6 might be showing that a person has the ST elevation. At the same time, reciprocal ST depression will be seen on the opposite part. तो यहाँ पे क्या होगा? The inferior leads, lead 2, lead 3 and AVF might show that a person has the ST depression. I know this seems a bit confusing, but in the upcoming slides, I'll be showing you the pictures also, which will make it a bit more clear. When we talk about the inferior myocardial infarction, ST elevation will be seen in the inferior leads. वो कौन सी है? Lead 2, lead 3 and lead AVF. And when we talk about the reciprocal changes, the lateral part, that is your lead 1, lead AVL and V5, V6 and all. So inferior MI में आपके पास यहाँ पे changes होंगे. Then comes towards the posterior myocardial infarction. For posterior myocardial infarction, remember that you need to have 3 more ECG electrodes. Like we have to go for the 50 lead ECG. आपको V1, V6 के बाद में V7, V8, V9 लीड्स भी लगानी पड़ेंगी पेशेंट्स को, and then only you'll be able to assess the posterior myocardial infarction, right? So changes ST elevation will be seen in lead V7, V8, V9. So this is something which you have to remember. Most commonly, the patients have anterior myocardial infarction, lateral myocardial infarction, and inferior myocardial infarction. So we'll see the ECG graph and the changes in these three common types of myocardial infarction. So when we talk about the very first one, which is your anterior wall myocardial infarction, right? Anterior wall कौन-कौन सी हमने बताई थी? We talked about lead V3, V4, and we also talked about anterior septal, where V1, V2 can be affected. So when we see this ECG, you have to observe which lead? V1, V2, V3, V4. Here we can see V1, V2, V3, and V4. And हमें क्या देखना है? We have to observe for the ST segment elevation, right? So I'll just show you how it will be looking like. तो यहाँ आप देखो, V2 has the elevation, right? V3 also has the ST elevation. कितना ज़्यादा elevated है ये, right? Then we talk about V4. Here also you can observe the ST elevation. So you can see in the anterior lead, a person has the ST elevation. And if it is anterior septal, V1, V2 might also be having the elevated ST segment. Then this next one is your inferior wall MI. अब inferior leads कौन सी थी? We had lead 2, lead 3, and lead AVF. So we'll be observing these leads now. यहाँ पे आप देखो lead 2. Okay, lead 2 is also known as reference lead. You'll be observing here. See, your ST elevation. The ST segment should be somewhere in the isoelectric line. यहाँ होना चाहिए है ना, इसके ऊपर होना चाहिए. बट आप यहाँ देखो ST segment जो है वो इतना रेज हो चुका है ना. It has raised above your isoelectric line. So this one is showing that a person has the ST elevation कहाँ पे? On lead 2, right? Then the next lead which tells about the inferior part is your lead 3. Lead 3 में भी आप देखो, this is not normal, this is elevated. Same way you observe in these also, these are not normal, they are elevated, right? Then you observe your next lead, which is your AVF. This is AVF. यहाँ पे भी आपको same तरह की changes दिख रहे हैं. It means a person has the inferior wall myocardial infarction. I hope that is clear to all. Next, we'll be talking about lateral wall myocardial infarction. So when we talk about lateral wall MI, the changes will be seen on the lateral leads. Which all are the lateral leads? Lead 5, lead 6, V5, V6, lead 1, and lead AVL. So we'll try to observe the changes in these leads. है ना? यहाँ पे हल्का सा lead 1 में a little bit of elevation can be seen, but when we see lead AVL, yes, it is a bigger one. You can observe the ST elevation is bigger one in the lead AVL. So these portions which have been supplied by the lateral leads are having the because the person has lateral wall MI. So lateral leads में आपको क्या दिखेगा? You will be observing the ST segment elevation, right? I hope that makes it clear. I know that it is a bit confusing, but when you go to clinicals and you observe the ECG strip, then you'll be able to find out, yes, I have told you something like that, and let's try to explore it, whether it is present or it is not present. Many times the patient might be having combination of defects available present in the ECG. That's something different, but yes, for your understanding, you have to just memorize that. A person might be having your ST segment elevation, where the person might be having anterior wall, lateral wall, inferior wall myocardial infarction. And when you observe the ECG, you have to observe on the leads which are supplying that portion of the heart, and depending on which you can just clinically classify the myocardial infarction. Then we talk about the old myocardial infarction, right? हो सकता है patient को आज heart attack echo या myocardial infarction हो, after 10 years, if the person is coming to the hospital with something else and you just get the ECG done and then you observe the ECG of the person's, where you observing that a person has a deep Q wave. है ना, यहाँ देखो आप. Normally Q wave is not deep. Usually it is like on the isoelectric line only, or maybe 1 point, small one small box deep down, which is a normal length of the Q wave. But if it is deeper, which tells you that a person had a previous history. Abhi nahi hai, but the person had the old myocardial infarction. So this is how it will be seen on the ECG graph paper. Then comes about the next type of myocardial infarction, which is your non-ST segment elevation MI, which is also known as NSTEMI. इसमें क्या होगा? The patient will not be having the ST elevation, but apart from that, rather than that, the person might be having the ST segment depression or sometimes flattening of the T wave also, or inversion of the T wave also. तो यहाँ पे आप देखोगे that a person is having the ST depression. है ना, यहाँ this is normally, like we have talked about, this ST segment should be on the isoelectric line. This segment is dropped down, नीचे है ये. If it is down, it means a person is having the ST depression. And here you can observe that the person also has the T wave inversion. है ना, T wave जो है upright wave होती है, positive wave होती है, but it is depressed down. It is a negative wave here. So it means a person is having the non-ST segment elevation myocardial infarction, which is not that severe, but definitely it is also not a lesser thing, right? We should not be taking it lightly. So that's it from my side. Now I'll be showing you 3-4 ECG strips. You have to just look at them, try to just correlate whatever has been taught to you and just try to answer which kind of abnormality you can find that in those ECGs by typing it in the chat box. So the first ECG, you have to identify what is abnormal in this ECG. Is it normal or is it abnormal? And if it is abnormal, which abnormality you can find in this ECG strip. So I'll give you some time so that you can just see it, can analyze it, and then can just interpret what was the finding. Okay, you have to, now we have the second ECG. Here also you have to identify what might be abnormal in this ECG. Okay, so take some time and try to answer, try to recollect whatever has been taught to you. And then we have the third one. You have to just try to find out what might be abnormal in this ECG. And then we have the fourth one. Okay, this is the last one. Fine. So that's it for today. We talked about myocardial infarction, two main types of MI, STEMI and NSTEMI. Then different types of STEMI, anterior wall, posterior wall, inferior wall, septal wall, etc. The different types of ECG changes which happens in these myocardial infarction. And then about the old MI and about the NSTEMI also. If you know anything which I have not covered in this presentation, please let me know in the comment box. Thank you so much.